There was hesitancy in the beginning, I think, at the early part of the data to say that definitively because, and correct me if I'm wrong, there was worry that because the dependent variable that the drug trials were testing on were infections and not transmission, it remained possible, though not likely, that there was some hidden risk of transmission, right? And what I'm getting from you and getting from the CDC is like the data is coming back and that's not a problem.
You nailed it, Chris. That's correct.
Okay.
That's absolutely correct. The risk is extremely low of getting infected, of getting sick, or of transmitting it to anybody else. Full stop.
So Dr. Anthony Fauci is very clear about the amazing efficacy of the COVID vaccines when he spoke earlier this week, based on the data that we're seeing in the real world, right? Not just the trials. But what we didn't talk about, and we've been getting a lot of viewer feedback on this, is the fact that there are millions of immunocompromised Americans, about 3 to 4% of the U.S. population, for whom the shots may not work fully or at all. So what exactly should folks in that category be doing to protect themselves? And what does this new CDC mass guidance mean for them? As the co-director of the Center for Vaccine Development at Texas Children's Hospital, Dr. Peter Hotez is someone who understands that vaccines are not as effective in immunocompromised people, so they're at a higher risk for COVID infection even after vaccination, and he joins me now. So, Doctor, let's talk about who this group of people are. What are the various factors that could lead to someone being in this pool of folks that are immunocompromised?
Yeah, well, Chris, first of all, there's a lot of them. Roughly maybe 3 to 5% of the U.S. population that's been getting vaccinated. And we've given out 158 million doses of vaccine. So you do the math, that's, 5, 6, 7 million people. And it's probably the second most common reason why people send me emails. I mean, every morning I've got emails in my inbox from patients with who are on various immunosuppressive therapies. I mean, they range from bone marrow transplant patients to solid organ transplant patients to those getting corticosteroids or chemotherapy or getting CAR T therapy, T cell therapy, monoclonal antibodies to B cells like rituximab, splenectomy, primary immunodeficiency patients. So in aggregate, it's a huge number. And we're only now starting to really get data on how they do in terms of responding to vaccines, because most of them were excluded in the phase 3 clinical trials that led to emergency use authorization. So the good news is it looks like in most of these individuals, the vaccines are safe, or about as safe as they are in patients with normal reconstituted immune systems, or normal immune system. So I think that's good. The not so good news is oftentimes they do not respond well to the vaccines, particularly after a single dose. So individuals who with normal immune systems might have 50, 60, 70, maybe 80% response to a single dose of vaccines. For at least the solid organ transplants, maybe the bone marrow transplants, those getting other immunosuppressive therapies, it's about 17, 18, 19%. The good news is it oftentimes does come up after the second dose, but even then it's not always complete. So, the community of experts in this, the hematologists, oncologists, and rheumatologists who give a lot of immunosuppressive therapy are looking at the possibility of maybe we'll need a third dose in order to achieve better protection. Or the other big question is when to give it. Do you give it before you start immunosuppressive therapy? Likely. But if they're on immunosuppressive therapy, do you give it anyway? Or if you know they're going to stop it soon, do you wait for a period of weeks or months before you give it? So all of this is being looked at right now. It's a bit chaotic in terms of doing this systematically. It's kind of an informal network of hematologists, oncologists, rheumatologists that are talking to each other, various registries of small numbers of patients. So it's going to take a little bit of time to work out.
I mean, it seems like, well, there's two things. One is we want community level suppression, right? I mean, we want to keep vaccinating as much as possible and drive the case number down because the base rate of transmission is going to affect the risk for everyone. So that's a no-brainer. We want to push more vaccines, right? So that's but for the particular sort of behavioral effects for folks that are in this category or their loved ones, I mean, does it mean that they should still be wearing an N95, that they shouldn't be doing some of the things like, flying or getting in large crowded groups, all the things that we've been avoiding pre-vaccine?
Yeah, that's right. So I think, if you're a renal dialysis patient, or if you're a solid organ transplant patient getting immunosuppressive therapy, or if you're a bone marrow transplant patient, or a number of others on that list, I think what it means is you have to behave as though you're not vaccinated. You may be protected, but we don't have that full slate of data on it just yet.
And I think it points to the larger issue here, which is we just need to keep penetrating the population in terms of vaccination, because we're seeing cases go down. We just got to keep that going, because that's the ultimate thing that is going to keep everybody safe, whatever their particular exposure or risk or particular medical situation is. So just keep that in mind.
Yeah, here's what we need to do. We need to get 75, 80% of the U.S. population vaccinated. And because the little kids are not yet eligible, that means just about all the adults and adolescents if we're going to protect everyone.